back to the Dissociative Table. I'm Alex Furchess. This is the third part of a conversation I had with dissociative disorder guru of the EMDR world, Dr. Sandra Paulsen. In this segment on the S in her N.E.S.T treatment model, she talks about what she's probably most famous for, which is the integration of ego state therapy with EMDR and somatic techniques. Enjoy. Like I said, the literature that most of the listeners this program might be reading sort of presents that client that comes in and it's very easy to work with parts all of a sudden, and how you're using somatic techniques to make that not quite so frustrating, because that's not how it is.
Well, let's see. I use somatic techniques in conjunction with ego state therapy by interviewing body parts, especially if there's a somatic holding that isn't resolving. It's like a somatic or an ego state interweave where I'll say, like, if there's a stuckness of a feeling in, say, the chest or the throat, or pressure in the head or something, I'll interview it. Pressure in the head is a special case because that's usually represents an inner conflict where one part of self is approaching and one part of self is avoiding. But when there's a holding elsewhere in the body, I'll interview it just the way I would interview an ego state or an altered personality. So throat, we're listening. What would you like us to understand? Throat, I bet there's a good reason why there's a stuckness there. Throat, is there something that you would have said? Grown-ups listening now. So it's the distinguishing adult self from, in this case, it's throat, but it's probably also an age-specific ego state, but the access method is through the somatic symptom of the holding, the energetic holding in the throat, in that example. So I do that a lot. And I'm constantly saying to people, what are you noticing in your body? What do you notice? Because some of them are off doing talk therapy.
Right.
And yeah, cognitive channel is important. Of course, we're not trying to eliminate it, but it's not the only channel. It's also legitimate to fractionate by channel. So maybe they want to process cognitive first. Fine, but we're going to go back and say, and when you think of event X, fire, car crash, how much disturbance now? 0 to 10. 3, where is that in your body? What is it? Where is it in your body? It's still that feeling in my gut. Gut, we're listening. Just notice, and then adding bilateral stim and checking back periodically with gut. And typically it'll move along, but sometimes it's because there's something that the adult self is pushing away. And you can frame that as a phobia, that they're I mean, I don't normally need that word to think about it, but certainly people that can't begin to tolerate doing ego state work, I would use the word phobia, like it's phobic avoidance of the mental contents, including affect and body sensation and awareness. But here, during an otherwise successful process, if there's a looping, what we in EMDR land call looping, stuckness, then interviewing whatever body part is involved, well, I'll either have them glance in the conference room and tell me what they see, or have them do a body scan, see where the holding is, and add energy. And I don't know where my photonic is, but I use it as the photonic is another neuroaffective, so it's under N. Where is it? I don't know if I can easily find it. I'm going to just look one place, see if I cannot trip on all my chords. That's going to be on my tombstone. Something about chords. Nope, it's not where I expected to find it. But the photonic is a soft, I don't know if it's the one I have is a soft laser or an infrared, but the idea is that you can have the client hold it against a place where there's a somatic holding, and it adds energy, which then gets it unstuck. It's kind of like Reiki, only automated. Because Reiki, Rei and Ki, the Japanese words, Rei is something about universal energy, the energy of the universe. And Qi is like Qi, Chinese word Qi. Qi is Japanese and Korean, I think. I'm not sure. But it's the energy that is in the body that either moves or is stuck. And so what they do in Reiki is they bring in, the practitioner brings in that universal energy, which adds energy to the body and sort of flushes out, that gets it moving, gets the body's energy moving. Well, that's what the photonic does too. You can have the clients hold this soft laser. It adds energy to wherever there's stuckness, and then it moves along. It's quite nifty.
Yeah. And, people should also remember that you are the author of dozens of scientific papers and this particular book. And the concept of, I was watching a YouTube video where they're saying that the Western understanding of like chi is a little bit more metaphysical than it's thought of in the Eastern world, where it's more just like energy, like something that is, like it can be understood and,
Right.
by someone who is a reductive materialist, I suppose. Although I think they would have trouble explaining what they mean by understand if you press them, but I don't want to poke fun at listeners who might have that worldview. Nonetheless, it can be researched. And what you're speaking about, yes, energy psychology has research behind it, even if you view it as metaphor. Or, I suppose some people might think, oh, well, it's hypnotic suggestion or something like that. Well, if it works, then you
Well,
don't necessarily have to.
I'm not prepared to prove this, but my understanding is that there have been some strides made in measuring subtle energy. And I hope that's true. Although I remember I went to an energy conference and one of the engineers there was saying the problem with trying to do research on subtle energy is how do you set up the control condition, because you'd have to have a prayer-proof room to prevent energy from coming in.
Like, let's see, not lead lined, but something else.
Something.
I,
Maybe
yeah,
frankincense lined. I don't know how that
right. Um, I suppose, if people don't want to talk about energy, people talk about transference and countertransference, right? So, okay, well, maybe that's a way to conceptualize it. And oh, there's so much else. There's so much conversation there. And but I really do want to get to the S
All right.
in Nest. I have like 15 more questions on that one that I'd love to hear you riff on, but hopefully we can have you on again. So in any case, so if you don't mind, we'll continue that. So the S in Nest, self, it's impossible to, well, it's one acronym, N.E.S.T, because you can't separate these components. So you've already been speaking a lot about ego state therapy and structural dissociation, which, not everyone separates from somatic dissociation, but your understanding that's that's natural to this, well, the early trauma protocol, as you had mentioned. My first thing to maybe get started on the ego state therapy branch of the N.E.S.T concept is, with ego state therapy, practically speaking, for a lot of like busy clinical listeners here, they've heard about ego state therapy. Well, there's few enough theory resources. I mean, you've pretty much got two main ones. I mean, you've got Watkins and Watkins number 1 and number 2. You've got Forgash et al.'s, EMDR integration, and then you have your books.
So also the first book in ego state therapy was actually not Watkins and Watkins. It was Phillips and Frederick's book.
Really?
Yeah, I forget the name of it now. I should know that. But it was like 1995, I think. And then the second book was, I think, Gordon Emerson at Crown Books in Australia. And he's both Phillips and Fredericks and Emerson were students. Were students of Jack Watkins and Helen Watkins. He died before I met him. Mm-hmm. I met him when I was presenting in Germany at the first World Congress of Ego State Therapy. He liked the way I present. I talk about ego state therapy with cartoons. So, and we collaborated for a few years. So then, Forgash and the same, I'm trying to think, Forgash was 2009, I think. And then my book on ego state therapy was 2009.
Mm-hmm. And so there's, you know, a lot of it is pretty theory heavy and pretty short on interventions, except for your work. And so your work, of course, is integrating EMDR. Not everybody is, you know, some listeners have gone, probably the majority of listeners have gone a different way in treating complex trauma, although I hope that they would consider getting a, you know, an internationally approved EMDR training. Nonetheless, I think that, okay, so internal family systems, right? That's why this method of working seems popular. And Schwartz has a chapter in that Forgash book, I think. Yeah, he does. But IFS presents this out-of-the-box useful set of techniques that's very practical, just like you can just out of the box, you've got like it's sort of like reading one of these Milton Erickson books that I've got. It's just technique after technique after technique with demonstration. And so I think more people are using IFS to deal with complex trauma than ego state therapy, even in the EMDR world, because it's like my consultees ask, it's like, well, just tell me what to do.
Yeah.
I don't have
and they've
time.
Been very good at marketing. They've been extremely consistent with marketing.
And so I don't know if there are other resources. I mean, there's let's see, where is it? Easy Robin Shapiro's Easy Ego State Interventions, but that's also EMDR specific, very
Maggie Phillips' book has got some specific techniques scripted in it. It's interesting. So no, I don't have any other references for you beyond my own books, which are very tactical. The two, this one, which is entirely about working with structural dissociation using ego state therapy, and this one is about using the early trauma approach. And when I included discussion of complex clients, but it's in gray boxes if they're DID. So there's white and then there's gray boxes. So
so for those,
and then my brand new book. This one just came out a month ago. We're a listening body, and it's about the integration of EMDR, ego state, and somatic therapies. It's a verbatim transcript of a 3-day intensive, and it's got in the margins, this is kind of cool, in the margin, I don't know if you can see it, it's got little icons to show what kind of an intervention was done. Ego state, somatic, whatever. So,
and we've got,
that's enough of a plug.
Yeah, right. Vanderhart's Treating Trauma-Related Dissociation, kind of like a treatment manual for the haunted self almost. It kind of has that same sort of thing. But it's not ego state therapy interventions by and large. So yeah, so you had the kind of this really interesting answer that I will, with great tact, give to consultees when they start wanting to like prematurely integrate IFS and EMDR before they've truly learned EMDR. It's like, go for it. It seems to work, integrating IFS and EMDR. But in one of your trainings, someone asked, why don't you use IFS? And your answer was what moved me toward, a different way of doing things, honestly, was I can't speak. It doesn't allow me to speak to perpetrator parts. Right. It comes with a it comes with a method of working as well as a personality theory that may not match up with some of the complexities of what you've been describing. So practical, but at what cost? More to come in the second half of this conversation. Check out Dr. Paulsen's books, endorsed equipment, and more at paulsenpsychology.com. If you're enjoying this conversation and you're a clinician treating complex trauma or a student learning how, email dissociativetable@gmail.com to join the discussion on the clinicians only discussion board. I started out working with IFS myself. And I recognized that my first client ever in my graduate practicum, which was at a domestic violence center for women, why they took me on, I have no idea. I recognized that my first ever client had DID. I still have her notes in my box. Working with IFS, I was also reading the collected works of Carl Jung. And what I noticed was these IFS techniques were offering access to her experience in a way that I hadn't thought possible, yet what I was seeing was better explained by what Carl Jung was talking about. Yet Carl Jung offered no, well, immediately practical ways of working with this, whereas IFS did. Ego state therapy seems to hit kind of a middle ground of being able to work more efficiently without having 5 to 7 years of analysis or something like that. But yet kind of a lack of book of techniques. In the absence of that right now, is there a training that you would recommend, maybe in person or online, for someone wanting to start work with ego state therapy?
Yeah, well, certainly I have lots of workshops available through the Steve Frankel group, sfrankelgroup.com, SFRANKEL group.com. And there's both a 2-day ego state workshop, and the 2 days reduced by the number of minus practicum. And there's also a year-long N.E.S.T series I did that has an ego state work was, I'm trying to think if it was modules 4 and 5 or 5 and 6 or something, can't remember, but it's all listed there.
Mm-hmm.
And that's organized by phases. But I do want to say that, you know, I did work closely with Jack Watkins, and he was aware of IFS. And he was very good natured. He didn't experience much of anything as a threat, or he just laughed. But he said that what distinguishes ego state therapy is that a stance of curiosity, because you want to know how the system organized itself.
Mm-hmm.
So there isn't an assumption that there's got to be
Right.
firefighters, got to be
Mm-hmm.
this, got to be that. Although I understand, you know, concept, there's some of these circuits are hardwired, but there's an openness and curiosity to ego state therapy that unfolds. And so that's why you don't find cookie cutter interventions. There's one huge difference, I think, unless they've changed things, but a huge difference in IFS and ego state therapy is that, as I understand it, with IFS, you primarily work through the front part of the self, having the front part communicate with all the other parts of the self. And the idea is that that's more integrative. And there are many people in the dissociation field that work that way and think that that's the way to work. But in ego state approach, there's an idea that you differentiate the parts and add energy. I mean, this 1949, Paul Federn, student of Freud, he was the first to use the term ego state. He didn't have a therapy for it. That was Jack Watkins. But the idea was that you add ego energy, and the arcane term is ego cathexis. But you add energy by speaking directly to a part, Jack would say, John G. Watkins, or you can add object energy by speaking about a part or having another part look at that part. But the therapist does not stop from, is not stopped from adding the energy by speaking directly to the part. Now, I have had, and I certainly don't think it's less integrative, because, you know, as it's plenty integrative, but I have had, my whole practice is these intensives, and at least half, maybe more, of my clients are mental health professionals who come to me for the intensive. Many of them are IFS trained or have been treated by an IFS therapist. And I have heard so many times, I've seen them, they just get hopping mad, not at me, but because they just spent 5 years doing IFS training, or I don't know how many years, and the ego state maneuvers go so deep, so fast. It's much more surgical. The adding ego energy to a part by speaking to it directly, pulling it forward, making it executive to the degree it's possible. I mean, if they're not DID, they can't take over the body completely. But, and then that one really gets airtime. And I've had people just be astounded by the results we were able to get so fast that they couldn't get an IFS. So, I mean, I don't know if that's necessarily true, or if they just, it's the luck of the draw or what, but I've heard that a lot.
Mm-hmm. Yeah. I think there is an attraction to a system. You know, there's an attraction to some sort of integrated system where it's well packaged, like you said.
Oh, you mean the therapy?
The IFS is well packaged, and you know, you buy a box and you take it home and you open it up and take it to your office, and that sort of thing. Okay, so however,
I'm sure they're doing good work. I don't mean to say I don't think it does any good.
Yeah, for sure. For sure. Just like there's probably,
I just like ego stay work better.
Right. So, all right. So I'm going to play devil's advocate. All right. So let's see, what is this? Is this in The Haunted Self or? Okay. So I think it's in The Haunted Self. Like one of the 2 books that changed the way that I work. You're Looking Through the Eyes and The Haunted Self. That I wish someone had handed those to me out of graduate school. So in The Haunted Self, in the first chapter, it presents objections to this idea of, well, working with parts, right? Even in the face of a study that Denise Galinas presented, I forget, 2015 study that shows that when you work with parts, outcomes are like way, way better with trauma. Okay, just throw that to the side and forget that you can say perhaps it's metaphor. But Vanderhart quotes some folks as saying, well, actually there's the appearance of parts because the parts are created by the therapist. The therapist assumes that there are parts and imposes this concept on the client, and in this sort of suggestion, the client comes to believe that they have parts and so on. Okay, so here's the devil's advocate question. In that same Denise Galinas training, somebody came up with a question and said, well, my client has 137 parts and we've been working for 15 years. And it's like, I'm not so sure about that. And one objection people might have with ego state therapy in particular is when you add ego energy, you could be assuming that a part is there, right? So what would you say to the idea that there's a degree of suggestion in working directly with a part of self as opposed to the client being curious about that part of self? Isn't there a danger of by speaking to that part, actually creating a part by assuming it's there?
You mean like assuming that a perpetrator interject is there?
That would be the biggest one. That would be the biggest thing. Although, you know, it's from my own perspective, I have my own perspective, but I'm playing devil's advocate here. Yeah, like assuming a perpetrator interjects as they're speaking to it, and Someone might say, well, of course there's a perpetrator interject. You just introduced it.
Well, number one, I would, if it comes up as a result of a headache or another bodily symptom, I'd say, well, where did that symptom come from? And how come it resolved when I spoke to the part? And how come the person did much better once I got the perpetrator interject on board? So if the symptoms reduce and the person's more stabilized after this maneuver, then I don't care what it is. It helped. And I don't keep doing something that makes the person worse. I only do things that make the person better. Although with it's like with surgery, you can temporarily cause upheaval if you do EMDR. But if you do it properly, it goes well if you get the parts on board. So to me, the benefit of, okay, so like right now, I invite the listener to think about their mom or their dad, whichever one is the sort of more powerful person in the family. If they think about that person, and then if we say, hi, parent part of the self, what do you want the girl or the boy who's now an adult to know? And listen, they will perhaps hear something. I'm pausing. And that I'm doing that simple maneuver just to show that that we have interjects. Unless your parent's in the room, when you visualize your parent and hear it talking, that's like a holographic likeness because the person was well known to you for many, many years and very formative. That wasn't a proper intervention there, but although I will add in the name of precaution that any fierce protectors can put things back the way they were if that caused any furniture to get rearranged right there. But my point being, it's completely normal to have holograms in our head of our parents. And I'm lucky. My mom hologram is, she talks about how to make a nicer pie. But if people have a malignant mom, that hologram is going to be saying mean things. And so it's not much of a leap. If a person has a headache that comes up suddenly while they're talking in therapy, and I always tell people, let me know if a headache or even pressure in the head comes up suddenly right before, during, or after a session, because that's important. I consider it my turf. And because that means there's a push-pull, the client's own point of view and parents' point of view, saying, don't tell the secrets, don't badmouth the family.
Yep.
If we weren't such a brat, this wouldn't have happened, all that kind of stuff. So if I've given two bits of evidence there. One is if a bodily symptom emerges in an intervention, then to me it has extra weight, because where did that come from if I didn't suggest that bodily symptom? If it comes up as a result of trying to speak to a part, then that's a pretty tangible suggestion, implication that there's something happening that's real internally. And secondly, if the person feels some relief as a result of the intervention and they achieve better stabilization and the self-harm stops as a result of working with the perpetrator interject, well, that's pretty clear proof that that intervention was helpful. Whether it proves that an interject exists, I tend to think so, but that's how in the human species, that's how we transmit cultural expectations, is through the learning from our parents at home, and then the holograms in our head. In my trainings, I always say, I can hear my mom saying, Sandra, pick up your socks. It's the only reason I pick up my socks is because I got a mom interject telling me to pick up my socks.
Thanks for tuning in. What I especially enjoyed about this episode was Dr. Paulsen's bold and unapologetic answer to those who object to dealing with dissociative parts of the self. As for me, when there's a brain surgery to address restoring and redeeming the narrative of an abused and neglected child, I'll stop working with parts. As always, thanks to the band Crack Machine for donating the rights to their music to this program in support of increased global access to effective trauma treatment. You can check out their new album at their Bandcamp website.